So are there symptoms that may not, you mentioned osteoporosis. Are there
Mhm.
symptoms that may not be, people might not be thinking of as hot flashes or, my period is every month, but my bones ache. You know what I mean? Like, are there symptoms that people might not be really, might not know are symptoms?
Um, Possibly. You mentioned bones and muscles, like muscle pain and joint pain are symptoms of perimenopause and menopause. So I don't
Mm.
know if people often equate those things. Um, Sometimes, sadly, medical professionals don't equate those things either. Dry skin, thinning hair, even losing hair, that's an aspect of it. Um, yeah, and then I think the others are more commonly known. So night sweats, hot flashes, weight gain around our middle region in particular. Um, Pre-diabetes is quite common for women in perimenopause and menopause. Um, yeah, painful sexual intercourse becomes an issue, anxiety and depression. And what here's something I should point out since you're asking, what are the things that can happen that we don't often equate with perimenopause and menopause? Um, Plummeting or decreasing self-esteem and confidence. And again, this is related to hormones, the fluctuating hormones, but it's also related to the period in our life. So a lot of women in middle age are becoming empty nesters. Maybe they're retiring. Wish I could retire, but not yet. Um, they and they might start having different feelings about who they are as a person. Their identity is changing a little bit. So it's not uncommon for women in their 40s to say, you know what, this career that I've fought tooth and nail to build no longer inspires me.
Mm.
I'm bored by it, or you're being overlooked at work because you're no longer the shiny new rising star. The new tranche of younger folks have come in. And also, you could start feeling a little bit, I'm just going to use the word dismayed, maybe with your partner. If it's someone you've been with for decades, maybe suddenly the way they breathe or the way they chew is just driving you nuts. Or maybe it's bigger than that. Like you actually don't feel like you're able to connect with your partner as much or be able to connect with your friends as much. And this is because of estrogen. It's also because we have decades of experience and life behind us that has us knowing what we will tolerate and what we won't. And we're more likely to say, this relationship doesn't serve me, or it doesn't serve me like it used to. Something has to change.